My specialty is diabetes, and I've been involved in the field of diabetes for almost 30 years. My former life, when I was a full-time professor at the medical school at Wayne State, we ran into each other and got to know each other because we were all faculty members. I got involved in Mirafit because my clinical interest obviously has been always in the metabolic syndrome, which includes obviously obesity, overweight, diabetes, high cholesterol levels, high blood pressure levels. And I needed to see if there's something available for my patients to make them do better. And so when I was approached by Drs. Jen and Artis about this potentially exciting product and they needed to move it, I guess, into the clinical arena, it was a natural fit. The results were exciting because it turned out that patients who were on the product wound up actually losing some weight, and more importantly, the metabolic profile did improve. Because remember that we were talking not just the weight loss, but the health benefits. So anything which can improve not just the glucose profile, but also the lipid, the cholesterol and triglyceride levels is beneficial in the long run. The underlying problem we face as a society, and I guess the rest of the world, is the incredible epidemic of metabolic syndrome. Okay, and then people say, what's metabolic syndrome? And it's, as you mentioned, metabolic syndrome includes those elements of obesity and especially extra weight around your waist, elevated blood pressure, elevated blood glucose, diabetes, and also elevated blood lipids, meaning cholesterol and triglycerides. And so it happens that if you lose weight, and hopefully can keep it off, all of those things move in the right direction. So the blood pressure goes down, your lipid levels go down, the glucose goes down, and obviously weight improves. So the benefits are, obviously all over your body. And in addition to that, as I always point out to my patients when they lose weight, there's less pressure on their joints, obviously on the heart, the lungs, and so you're talking about other improvements which might not be as easily measured, but clearly people's lifestyle will benefit. The question is, would I recommend it to my sort of immediate family members? It's a loaded question, obviously, because if I don't, then you say, well, why would anybody else use it? The answer is yes. And for example, my son, who is now 18, has been using it since the ripe early age of 13. And actually, quite a few of my other sort of immediate family members have used it for years. The results have been actually very good. Again, if it's used the way it's meant to be, and as you know, that there are some people, again, who look for the quick weight loss schemes, that really is not the product for them. This is for serious management of weight, hopefully through the rest of your life, and realizing those health benefits we talked about. The improvement in blood pressure, cholesterol, triglycerides, glucose levels, which goes along with weight which is manageable. The question is about the side effects, because one, as a physician, always has to weigh obviously the pros and the cons, the risk and benefit of anything you tell patients about. The nice thing about this product is that there really are no serious side effects. It's not toxic at any level. One can take it the way it's intended, and since it's a natural product, one really would not anticipate any untoward health effects. So no, I really have not seen any serious side effects in the patients who have been taking it. The product is sort of derived from natural corn fiber, and so as such, you really don't expect any deleterious health effects. That the metabolic syndrome with its obesity, high blood pressure, high cholesterol, high glucose levels is an epidemic, not just in this country, but in the rest of the world. And clearly, we are seeing the results of the lifestyle of the late 20th and early 21st century. And I think that anything which can help people manage the weight, given the way they live, will improve, hopefully, improve health outcomes. So clearly, if I'm devoted to taking care of patients with diabetes, by the way, 85 to 90% of my patients are overweight or obese. Clearly, anything which can help them to manage the weight is going to benefit in the long run the health outcomes. So I'm very interested and very excited, obviously, that anything which can help me.